Hello guys, good day. I am Carlo Pescada, a nursing student from La Salle University. Today we will be discussing all about influenza, and what are the pathophysiology or causes of the disease, the signs and symptoms, the risk factors of the disease, the prevention, the treatment option, and the prognosis of the disease. So what is influenza? Influenza, commonly known as the flu, is a highly contagious respiratory illness caused by influenza viruses. Each year, influenza affects millions of people worldwide, leading to a significant number of hospitalizations and even deaths. Influenza spreads from person to person through respiratory droplets when an infected individual coughs, sneezes, or talks. It can also spread by touching contaminated surfaces and then touching the face or mouth. The virus typically has a seasonal pattern, with outbreaks occurring during the colder months in temperate regions. Here's a simple explanation of the pathophysiology of influenza that is easy to understand. When a person with the flu coughs, sneezes, or talks, tiny droplets containing the influenza viruses are released into the air. If you breathe in these droplets or touch a surface that has the virus on it and then touch your face, the viruses can enter your body. Once the influenza viruses enter your body, they attach themselves to the cells lining your respiratory tract. Think of these cells as the body's security guards, protecting your airways. The viruses then invade these cells and start multiplying inside them. Your body's immune system recognizes these invading viruses as harmful and starts fighting back. It sends immune cells to attack the infected cells and releases substances called antibodies to neutralize the viruses. As a result of this battle between the viruses and your immune system, inflammation occurs. Inflammation is the body's way of responding to an infection, and it can cause symptoms like fever, cough, sore throat, and body aches. So let us further explain the signs and symptoms of the disease. Fever is an increase in body temperature that occurs in response to an underlying condition, usually an infection or inflammation. It is a common symptom experienced by people of all ages and is often a sign that the body's immune system is fighting off an illness. Coughing is a reflex action that helps to clear the throat and airways of irritants, mucus, or foreign substances. It is a natural defense mechanism of the respiratory system designed to protect the lungs and maintain their function. It's important to note that while coughing is a common symptom of influenza, not everyone with the flu will experience it. The severity and duration of the cough can also vary among individuals. A sore throat in influenza is a common symptom characterized by pain, irritation, or scratchiness in the throat. It is often caused by inflammation of the respiratory tract due to the influenza virus. Sore throat can contribute to coughing and discomfort while swallowing, and it usually resolves along with other flu symptoms as the infection runs its course. Headache is a common symptom experienced during influenza. It is characterized by a pain or discomfort in the head, often described as a dull, throbbing, or pressure-like sensation. Headaches in influenza can be caused by various factors, including inflammation, fever, sinus congestion, and overall illness-related body aches. Sneezing is a reflex action of the respiratory system that occurs in response to irritation or congestion in the nasal passages. In the context of influenza, sneezing can be a symptom caused by the inflammation and congestion of the respiratory tract due to the influenza virus. It is a way for the body to expel irritants, mucus, or foreign substances from the nasal passages, helping to clear the airways. Fatigue is a common symptom experienced during influenza. It is characterized by a persistent feeling of tiredness, weakness, and lack of energy. Influenza can cause fatigue as the body's immune system works to fight off the viral infection. Now let us proceed to the risk factors. Age. Young children, older adults 65 years and older, and infants are at higher risk of complications from influenza. Chronic medical conditions. Individuals with chronic conditions like asthma, diabetes, heart disease, or weakened immune systems are more vulnerable to severe flu-related complications. Pregnancy. Pregnant women are at increased risk of severe illness from influenza due to changes in the immune system. Weakened immune system. Immunosuppressed individuals, such as those with HIV/AIDS or undergoing immunosuppressive therapy, have a higher risk of complications. Obesity. Obesity is associated with an increased risk of severe influenza illness. Occupation. Healthcare workers and individuals in close contact with infected individuals, such as caregivers or household contacts, have a higher risk of exposure to the disease or virus. Now let us talk about the preventions in order to prevent from acquiring the disease. First and the most effective measure is vaccination. Getting a flu vaccine is the most effective way to prevent influenza. Vaccines are updated each year to target the most prevalent strains. Next, good hygiene practices. Wash your hands frequently with soap and water, especially after coughing, sneezing, or being in public places. Use hand sanitizers if soap and water are not available. Thus, avoid close contact. Stay away from individuals who are sick with flu-like symptoms to reduce the risk of infection. Lastly, keep surfaces clean. Regularly disinfect frequently touched surfaces such as doorknobs, phones, and keyboards in order to reduce the risk of acquiring the virus. Now what if you already acquire the disease? Don't you worry, I got you. Here are some treatment options that will help you treat the disease. First and foremost, rest. Get plenty of rest to allow your body to recover. It may seem common but, yeah, having enough sleep will help boost your immune system. Next, stay hydrated. Drink fluids like water, herbal tea, and clear soups to prevent dehydration. Next, over-the-counter medication. Non-prescription pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help alleviate symptoms like fever, headache, and body aches. Follow the recommended dosage instructions by the healthcare provider. Next we have antiviral medication. Prescription antiviral drugs may be prescribed by a healthcare professional to reduce the severity and duration of symptoms. They work best when taken early in the illness. Lastly, symptom relief. Use cough drops, throat lozenges, saline nasal sprays, or decongestants to alleviate specific symptoms. Prognosis. Most people recover from influenza within a week to 10 days with appropriate care. Complications. In some cases, influenza can lead to complications such as pneumonia, bronchitis, sinus infections, ear infections, or worsening of underlying medical conditions. Severity. The severity of influenza can vary widely, from mild cases with minimal symptoms to severe cases requiring hospitalization or leading to death. And that is all. Thank you for listening. I hope you learned something about the said topic. See you in the next video. Please leave a like, and touch the subscribe button.